I think this has put the medical community and our patients in a big quandary of trying to balance real current risks of COVID virus and the infection, and the need to minimize that risk, which means staying away from people, wearing masks, social distancing, not coming to a healthcare facility unless you need to, with the potential future harms of delaying care, and particularly delaying preventative care. Preventative care reduces the risk of cancer mortality by finding cancers very, very early when they're easily treated and very successfully treated so that they don't become life-threatening. So we can model the number of deaths that are prevented by cancer screening, and you can then use that data to model if there are these gaps in screening, because screening centers are shut down. Patients are afraid to come to a healthcare center. What's the impact on that? The scary number is NCI's current best model suggests that we will see 10,000 excess deaths just from breast cancer and colorectal cancer. Now, if you think about other cancer screenings, pap smears for cervical cancer, low-dose CTs for lung cancer in current and former smokers, even things like physical examination that may find abnormal lymph nodes, abnormal skin lesions, that number is almost certainly higher. We had to balance those own considerations as we were thinking about what services we would provide. So in Indianapolis, during the peak period at our highest virus rates, we were not doing screening colonoscopies. We were not doing screening mammograms. We were certainly taking care of patients who had those diseases. If you had a lump or had an abnormality, those were still being evaluated. But if it was purely a screening exam, we put those off. But those screening exams were delayed or put off for a period of about 6 weeks. And then we have been reintroducing screening. Now, the rates and the number of people that we're seeing are still not as high because we want to have time for extra cleaning, to have time for social distancing. But I think there is a difference between delaying screening for a few weeks or a couple of months and skipping screening entirely for a year or two. The medical community takes this very seriously. So I think in some ways people think of a hospital in a healthcare setting as one of the most dangerous places that you could go. And I'm not sure that's really accurate because we're taking so many precautions, doing so much extra cleaning and sterilization. Everybody here is wearing a mask all the time. I think this also gives us an opportunity to think about risk-based screenings. And those may also be ways for people to kind of navigate this difficult world, depending on their age, their family history, their unique risk factors. Some screenings may be much more relevant for them because they have higher risk of those diseases than others. So those may be ones to continue to do right now, and others may be ones that you might want to put off for a few months and then reevaluate. So this really does give us an opportunity to think about individualizing screening for our patients, to take all of their risks for those diseases into account, but also to take their risks for COVID into account. We might make very different recommendations for mammography screening. I'll pick as an example. For a 65-year-old woman who has chronic lung disease and no family history of breast cancer, no previous abnormal mammograms, than for a 52-year-old otherwise healthy woman who's had 2 previous benign breast biopsies and has a strong family history of cancer. The risk of cancer is different and the risk of COVID is different in those 2 patients. I think when we talk about cancer care, we have also found many ways to deliver cancer care that is both more efficient and safer. So we've found ways that we can follow up with patients through virtual visits and deliver excellent care. We've seen many of our new patients for a virtual consultation, when most of the consultation is really the education and the discussion. And putting together a treatment plan. I can not only do that more safely for patients on a virtual platform, it's also much more efficient than them driving an hour or two or three to get to the clinic and really taking an entire day out of their lives for them to come to see me. So while there are many changes that we have had to incorporate because of the pandemic that we can't wait to get rid of, there are some that really are helpful. They allow us to deliver better and more efficient care, but we learned how to do that because of the pressure of COVID.